Welcome to the Michigan Minds Podcast, a quick and informative analysis of today's top issues from University of Michigan faculty.
Thank you so much for joining Michigan Minds. I'm really excited to talk with you today. So can you start by introducing yourself and sharing a little bit about your role at the University of Michigan?
Sure. Thank you so much for having me. My name is Srijan Sen. I was a student here at Michigan. I did my MD and PhD here. And now I'm a faculty member doing research on stress and depression. I'm also a psychiatrist seeing patients, and I'm the director of the Eisenberg Family Depression Center at the University of Michigan.
Thank you. And can you tell us a little bit more about your research?
Sure. My own personal research is, as I mentioned, trying to understand stress and how it gets under the skin and affects our risk for depression, anxiety, and a whole host of other problems. A lot of my work has focused on this specific population of training doctors, residents. First year residents are called interns, and um, intern year is known in medicine as a very stressful year. This is the first time doctors have real clinical responsibilities. They're often working really long hours, not sleeping enough, and the rates of depression go way up about sixfold as they start the year. And so we've been studying this group for 16, 17 years now, ever since I was an intern, and gone in a few different directions. The hope is that studying this group will not only help training doctors, but this is a relatively unusual population where we know that there's a group that's relatively healthy, but then will experience a major stress. And so we can follow them as they go through this stress and hopefully understand more broadly how stress affects us and how different people react to that stress with depression, anxiety, or other problems.
Thank you. Data from the Intern Health Study based at the Michigan Neuroscience Institute and the Eisenberg Family Depression Center demonstrated how the more hours someone works each week in a stressful job, the more their risk of depression rises. Can you tell us more about this research and the relationship between hours worked and risk of depression?
Yeah, I'd be happy to. I think broadly what we're interested in is trying to understand the primary drivers of depression and poor mental health in different populations. And in our work and others, one of the factors that most strongly associates with depression is hours and particularly long working hours. So in the study that we did last year, we actually used sort of a relatively new statistical technique where you can emulate or mimic a clinical trial through observational data like we have in the Intern Health Study. In doing that, see what people's depression would be like if you actually assign them to work 30 hours, 40 hours, 60 hours, 100 hours in a week. And we found a really strong relationship between hours and depression. And in internship, people are working long hours, and those working 90 hours a week had about 3 times the depression increases as folks working 40 to 50 hours a week. And we saw the relationship between hours and depression hold across the spectrum of hours from 25 hours all the way up to 100 hours a week. So this indicates that in this population that work hours are an important driver and probably the most important driver of depression. And if we can reduce the work hours, we likely will reduce depression. I think work hours are probably an important factor in other high stress professions as well, and can be a target. But this, I'd like to think, shows the value of understanding the specific drivers in each population and then targeting them to improve mental health in that group.
Thank you. A recent study you co authored, published by the American Journal of Psychiatry, examined how social support received during stressful times can ease the impact of genetic depression risk. Can you share more about this study and discuss a few key findings?
I would be happy to. Depression, like many other complex disorders, has a genetic component. About 30 to 40% of the risk for depression is inherited. And in the last maybe 5 to 7 years, we've finally, as a field, started to make progress in identifying the specific genetics underlying depression. It isn't one gene or two genes or three genes. It looks like it's thousands of different genetic variations spread out across our genome, each one having a really small effect, but collectively having a relatively large effect on our risk for depression. And this paper is trying to understand how that the mechanism of how that genetic risk gets through to affecting how we feel and our mood and our risk for depression. One of the big environmental factors that plays a role in depression is social support. Broadly, we know the importance of social connection in our day-to-day functioning. The Surgeon General's office just released a report this week about the epidemic of loneliness in our society and the importance of social connection. And that's true in physicians and in our population. In this study, people who lost social support overall got more depressed. What we found was an interaction between the genetic risk, and here we used what's called a polygenic risk score, sort of adding up across the whole genome for your depression risk. And we saw in conditions of poor social support, when people lost a lot of social support, the relationship that we would expect, that people at high polygenic risk for depression were much more depressed and had many more depressive symptoms than people with a low polygenic risk score for depression. But as we went across the spectrum and looked at in situations where people actually gained social support and were in healthier social environments, we saw the opposite. People who had a high score on this polygenic risk index were actually doing better and were significantly less depressed than people with a low polygenic risk score. So it seemed to show that what the field had developed as a risk for depression might actually not be that, but might be more of an index of how sensitive you are to the social environment. And the people who struggle the most in poor social environments actually thrive the most in good social environments. And people with this polygenic risk score might benefit from prioritizing social connection in their lives, at least in terms of their mental health. And it shows how there's individual variation in how we respond to different stressors.
Thank you. And I wanted to talk to you a little bit about the Eisenberg Family Depression Center. As director, can you tell us about the research and work of the center?
I'd love to. So the Eisenberg Family Depression Center has been around at Michigan for over 20 years now. And really the goal is to try to catalyze innovations and breakthroughs that really allow us to make major progress in fighting depression, and doing it in many different ways. One is trying to identify and help promising research projects get off the ground through providing funds and bringing people together. The intern study that I've talked about a little bit benefited a lot from. It came out of the Eisenberg Family Depression Center when I was a student and an early faculty member, and there's been dozens of others really important studies that have come out of the center. For breakthroughs in fields as complicated as depression and these sorts of thorny problems, breakthroughs almost always come from the intersections of fields and bringing people together across disciplines. And so the Depression Center is really committed to doing that. There's people from all schools at Michigan and dozens of different departments who are interested in depression and have real value in helping to understand what's going on and make the discoveries that we need to improve the conditions and reduce the terrible burden that mental health problems are taking on all of us, from middle school and high school students through our students here at Michigan, in the workplace, older adults, and in all kinds of different situations. So we have core facilities that help bring people together, that help promote specific types of research that we think are most promising. One of those areas is projects using mobile technology, others using really big and promising data sets that could help us make major advances, and in areas that we think are really important, like school and college mental health, prevention of depression, and hopefully through these efforts can help make a real change and make real progress.
Thank you. During the month of May, we recognize and celebrate Mental Health Awareness Month. Can you share with us your perspective on this month and what we should be focusing on when reflecting on our well-being?
It's a really great opportunity for us to really recognize and think about our mental health and well-being and prioritize taking care of ourselves. As some of the work I've talked about, we know a lot about things like social support, and other factors that are critical in maintaining our wellness. And there's other factors that are also important and equally or more important, like sleep and getting adequate sleep and consistent sleep and exercise and avoiding work stress and eating healthy. And as some of the work that's come out of the center has shown, we each respond differently, and each of these different factors has a different sort of effect on each of us. So really taking the time to understand what the most important factors are for your own well-being and mental health, and prioritizing that has real value. It's also a real opportunity to talk amongst ourselves about mental health, and share with others if we're struggling, and helping others who might seem to be struggling. And we should be doing that all the time. And this is a great reminder to do that and do that more. And often great conversations really come from reaching out, even if it seems awkward or uncomfortable at first.
Thank you. And do you have any supportive or educational resources you would like to share?
There's a lot of great resources out there on our website at the depressioncenter.org. There's a lot of great information, and specifically a depression toolkit that has incredible information on self-help and getting help, and some of the factors that I've talked about in maintaining well-being, and making sure that we're prioritizing our mental health.
Wonderful. Thank you. And as the podcast comes to a close, we like to ask our faculty experts one thing you hope listeners remember from our conversation today.
Thank you. I think maybe a couple of things that maybe most importantly, remembering that none of us are alone in feeling it, particularly if you're struggling. It's hard to remember, but important to remember how many others are struggling too, and that you should really feel empowered to reach out for help from those around you, and professional help if needed. And there's so many resources out there, and so many people that care about all of us, that it's hard to remember that in times of crisis. And the flip side of if you notice someone around you struggling, really do feel empowered to reach out and talk with them. And we don't often know how much we help people by reaching out and having those conversations. I think the other sort of major point is really to prioritize our mental health, not only in times of crisis, but also in times of relative calm. That we can do so much to help ourselves and those around us by prioritizing broad things like we've talked about, like social connection and sleep and physical activity, and also figuring out what the most important of those factors are, or other factors are for our own mental health, and then making sure that we make time for that every day. It's important for us individually, and for our friends and family, and we can do so much good by doing that. So I think those were the major points I wanted to emphasize.
Thank you so much. It has been an absolute honor to talk with you today and learn from you. So thank you for taking the time to join us.
Thanks so much for inviting me and for having this great conversation.
Thank you for listening to the Michigan Minds podcast, a production of the University of Michigan. Join the conversation on social media with #UMichImpact.